Hypersensitivity pneumonitis, or HP, is a type of interstitial lung disease. Interstitial lung disease is scarring or inflammation of the lungs, and that's really an umbrella term. And there are a number of different causes, for example, autoimmune conditions or different occupational exposures. HP happens when a patient has inflammation in the lung caused by inhaling a certain antigen that leads to inflammation. Those antigens are typically going to be birds or mold, and that mold exposure can be in the home or in the workplace. Patients with hypersensitivity pneumonitis can experience a cough that doesn't go away, or they may experience shortness of breath. Over time, if left untreated, they can require supplemental oxygen or may even progress to the point of needing a lung transplant if not treated. The most important part of diagnosing HP is getting a really good exposure history from the patient. It's important to get a sense here locally in North Texas of the prevalence of HP from home mold exposure and to find out the characteristics of that exposure. We looked at patients seen at our University of Texas Southwestern Interstitial Lung Disease Clinic with a diagnosis of hypersensitivity pneumonitis over the last about 15 years. We then whittled that down to patients with HP from an identified mold exposure in the home. And we went through the clinical notes to identify features of that exposure. Mold typically follows water damage. And so we wanted to know first and foremost what kinds of water damage was leading to mold exposure. And we found that it was less often a single episode. It was less often a single pipe burst or a single flood. It was this chronic recurring water damage. So for example, it might be a pipe that was leaking underneath the sink for years and led to mold throughout the cabinets beneath the bathroom, or a toilet that was running that leaked behind the wall of the bathroom. And then we wanted to know how people identified this. And what's interesting is that while you can have an industrial hygienist come out and confirm mold exposure, most of our patients were able to identify the mold exposure just based on observing their house. So if you have chronic recurring water damage and all you do is bleach that area or paint over it, it's likely that you'll develop mold behind it because that doesn't effectively kill it. You really have to have a full remediation. And before we asked patients to do a really extensive mold remediation in their house, we wanted to know how significant is the mold exposure? What does mold look like in North Texas so that we can inform the treatment of our patients?